Welcome our panel today, all of whom are from the Washington State Department of Health. We have Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, Michelle Roberts, Acting Assistant Secretary, Lacey Fehrenbach, Deputy Secretary for the COVID-19 Response, Andrew Rose, COVID-19 Incident Commander, and Les Becker, Deputy Secretary for Innovation. To begin today's briefing, we will open with remarks from Michelle. Go ahead.
Well, good morning, everybody, and thanks for joining us today. We're glad to be with you giving a few COVID updates. As Julie said, I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. Our hard work continues to happen across the state every day as we inch closer to reaching our goal of vaccinating everybody who's eligible. As of October 23rd, we've given out more than 9.5 million doses of vaccine. It's really exciting to be rounding the quarter towards our 10 millionth dose. More than 78% of the state's eligible population has received at least one dose of vaccine, and more than 72% of people aged 12 and older are fully vaccinated. Being vaccinated is the safest way to protect you and those around you, especially as we head into the holiday season. If you've not been vaccinated, visit our vaccine locator website and make your appointment right now. By now, I also hope you've heard that even more people are eligible to get a booster dose of COVID vaccine. Last week, the CDC's Advisory Committee and the Western States Scientific Review Group recommended boosters for all three vaccination types. Everyone 18 and older who has received the J&J vaccine can get a booster dose at least 2 months after they received their first shot, and at least 6 months after completing a Pfizer or Moderna vaccination series. Certain groups of people are eligible for a booster, including people age 65 and older, as well as people 18 and older who live in long-term care settings, have underlying medical conditions, or at increased risk of social inequities, or live in or work in high-risk settings. Already, more than 363,000 people in Washington have either received a booster dose or a third dose. Another important milestone I know many parents are eagerly awaiting is vaccines for kids age 5 to 11. And I'm so happy to report we are one step closer. Yesterday, the FDA's Advisory Committee met and recommended a smaller dose of the Pfizer vaccine be authorized for kids, for younger kids, age 5 to 11. Next step is FDA's formal decision on their Advisory Committee recommendation, and then the CDC's Advisory Committee, which is scheduled to meet November 2nd and 3rd. After that, the Western State Scientific Safety Review Work Group will also meet. This means vaccines for kids age 5 to 11 could happen as soon as the end of next week. We've already started planning to ensure vaccines will be available to Washington as soon as they're authorized and recommended. Once we have an update, we'll be sure to let you know. Right now, we can protect our families by getting our older kids vaccinated. All 12 to 17-year-olds are already eligible for the Pfizer vaccine. And so far, more than half of that group is fully vaccinated. In closing, the more people that are vaccinated, the better off we all are. COVID-19 vaccines are safe and highly effective in preventing serious illness and death. If you haven't been vaccinated yet, today is the perfect day to make an appointment. You can visit the state's vaccine locator website or vaccines.gov, where you can even search for specific vaccine types. You can also find vaccine locations near you by texting your zip code to GetVax, which is 438-829, or call our COVID-19 hotline at 833-VAX-HELP. The VAX-HELP number can also help you get your records in My IR if you are not able to match automatically. If you have questions, visit DOH's Frequently Asked Questions page or talk to your trusted healthcare provider. And don't forget, you can get the COVID-19 vaccine on the same day as your other vaccines, like your annual flu shot. We recommend a yearly flu shot for everyone 6 months and older. Thank you. And back to you, Julie.
Thanks, Michelle. Let's go now to Dr. Lindquist. Go ahead.
Yeah, if we could bring up that first slide of the epi curve, that would be helpful. Okay, and so really to give you a summary, I mean, we are at around 720,000 cases. This is just unbelievable to me as the state communicable disease epi, that we would have an epidemic with 720,000 cases. And that's probably not capturing all the cases. With that is around 40,000 hospitalizations, 40,000 hospitalizations, and 8,500 deaths. So this is a very humbling pandemic that continues to go on. And this epi curve really shows us that the disease is not slowing down. In some places around the state, it's actually starting to pick up again. For the most part, we see flattening of case counts, but we're at this very high rate of cases and hospitalizations and even deaths. And this is being driven by several factors. Some of this is obviously moving indoors with the change in weather, the fall gatherings. People are loosening up their masking behaviors, and then the hesitancy or refusal to vaccinate, multiple outbreaks. All these are contributing to us stalling out at a fairly high rate. Now, this is the fifth wave. I certainly hope we can turn this around before it becomes a sixth wave or an incredibly high plateau for the fifth wave. The main thing is we're on the cusp of, as Michelle just explained, expanding who we're going to be able to vaccinate. And really a message to you, if you're available or eligible for the vaccine, that you get your dose now so we can turn this around. Obviously, these three measures that we have to control disease, wearing a mask, distancing ourselves 6 feet in some cases, a little bit smaller distance in schools, and then vaccination are our three tools that can turn this around. The future of all these trends really depends on how we all respond to vaccination and masking and distancing. So with that, I'm sure we're going to be able to turn this around as we have with all these other waves. The biggest impact, of course, comes on the hospitals. There's been large hospital surge trends, and currently our occupancy for COVID-19 is around 16%. It was as high as 25% in early September. So this is clearly an improvement that we are going down to 16%, but the full occupancy of the hospital, so not just the COVID, but all the surgeries that were postponed, or our motor vehicle accidents or heart attacks that are happening, have got our hospitals at very high occupancy rates of around 91%. We see a bit of flattening in those hospitalizations, but again, this always lags behind the cases. And if we're starting to see flattening or an increase in the cases, it's not long behind that will come a flattening or an increase in the hospitalizations. So again, with the arrival of booster vaccines, with the discussion Michelle just had about vaccinating pediatric age group, there's still light at the end of the tunnel here. I don't want to leave us all with a real negative picture, but it is concerning we're this high and we're starting to slow down. So with that, I turn it back to you, Julie.
Thanks, Dr. Lindquist. Now let's go to Lacey. Go ahead.
Good morning, everyone. Thank you for joining us today. I'm going to give a few updates related to COVID-19 kids in school, following the Dr. Lindquist's overall review of the trends. So pediatric COVID-19 cases and case rates peaked around mid-September and have generally been declining among all age groups of children. However, they are still high, about 230 to 260 cases per 100,000, depending on the age group. We really do need to keep working, as Dr. Lindquist mentioned, on driving down those disease rates. This will keep our children safer, especially those younger children that aren't quite yet eligible for vaccine, or won't be for the very youngest ones. So appreciate everybody's help in the community on coming together around that. We are also going to be releasing our monthly update to the K-12 outbreak report later this week. I am going to share some preliminary information we have now. There were a total of 189 COVID-19 outbreaks reported in Washington K-12 schools between August 1st and September 30th of this year. 42 of those outbreaks occurred in August and 147 happened in September. There are 1,284 cases associated with these outbreaks in August and September, and the majority of cases, 88%, were among students age 19 and under. The month of September is the highest number of school outbreaks we have seen and had reported to us since starting this tracking with the return to school in fall of 2020. However, I want to share some important contextual things that are different this year. First of all, we're facing a more transmissible variant. The next is that we have a very high level of community transmission, and it was even higher during the months of August and September. We've seen over the course of the pandemic that outbreaks among school-age students correlates directly with the amount of disease in the community. So we would expect to see a high number of introductions into the school environment and a higher risk for outbreaks in schools. The third factor that I wanted to mention is that for the first time since the pandemic was declared in March of 2020 and schools closed and went to remote learning, we are offering full-time in-person instruction to all students this fall. So that means there are more students in a building or classroom at a given time, and they're present more days of the week. I do also want to share that the outbreaks are relatively small. The median number of cases in each of these outbreaks is 5. So that relatively small number of cases in each outbreak is an indication that schools are continuing to do a really good job on layered prevention measures and responding when they have cases and outbreaks. So it's a good signal to us that the layered prevention measures are working and schools are ready to respond when there are cases. I want to remind people that all the preventive strategies provide a level of protection, but none of them individually are 100%. Together, vaccines for those who are eligible, masks, ventilation, distancing, good hand hygiene, testing, contact tracing, and staying home when we're sick stack together to keep our students and staff safer in the school environment. We also know that schools are fundamental to child and adolescent development and well-being. And in addition to academic instruction, there are lots of social, emotional health benefits and even health services like physical speech and mental health therapy that kids get in schools. And the days out of class are pretty impactful. So when we have a high number of cases or outbreaks, there are a very large number of students that can potentially need to quarantine. And we are going to be releasing some updates to both our requirements and our guidance to help maximize in-person instruction for students while still mitigating the transmission of disease in the school environment. So the first change that we will be announcing is an updated requirement that indicates preference for the shortened quarantine option. So CDC, since December of last year, has offered 3 options for quarantine, and we have in turn offered those in our school requirements document. There's an option for a 7-day quarantine with return on day 8 if you have a negative test on day 5 or later. There's an option for a 10-day quarantine with no test. And then the safest option by CDC's guidance is the 14-day quarantine. As I've noted, we have allowed schools to use all 3 of these, but most have used the 14-day quarantine option. Given what we know about Delta's incubation period and the availability of testing in our schools in Washington State, as well as the broader community and the impacts of being out of school, we will be requiring schools to offer families the 7-day with negative test on day 5 or later quarantine option so that students can return to class more quickly. Additionally, For those schools that have a test to stay option, we are going to encourage use of that. So test to stay is a modified quarantine where students are allowed, even if they're a close contact, to continue going to school for classroom instruction only. And they participate in frequent testing during that 7-day period. The students in this program must otherwise stay at home as they would in quarantine, meaning no extracurricular activities, social gatherings, community-based activities, childcare, and the like in their 7-day quarantine period. However, they don't have to miss out on that opportunity for in-person instruction. If families choose not to test for any reason, then the school would use one of those longer options, the 10 or 14-day quarantine. The other announcements and updates we're making are some options to help schools streamline contact tracing and focus on priority locations where exposure or transmission is most likely. These are places where multiple students or staff are present for sustained period of time, or there's likelihood of really close contact or inconsistent mask wearing or adherence to other prevention measures. The goal here is really to use what we know about COVID-19 transmission, information from our outbreak investigations to help schools reduce the burden of contact tracing while also keeping their students and staff safer as we continue to navigate through the pandemic together. So, the last couple of things that I want to share, how to stay in school. Number one, and this is not new, this was already in place, but people who are fully vaccinated do not have to quarantine if they have no symptoms. So getting your child or getting vaccinated yourself is a great way to stay in the classroom and avoid quarantine. The second is the combination of masks and distance in the school environment when both the case and close contact are wearing masks and at least 3 feet apart. That is not considered a close contact, so there would not be a need to quarantine. For people who do need to quarantine because they are a close contact, using testing to shorten that quarantine period. So test to stay if your school has it, or doing the test on or after day 5 so that you can come back on day 8 once you've completed your 7-day period at home. My bottom line message here is to get vaccinated as soon as you're eligible if you're not, and today if you are and you're not vaccinated. If you have questions, reach out to your own healthcare provider or your child's healthcare provider. We really want our students, staff, and families to be protected, and vaccines are the safest way to protect the health and wellness of our children, staff, and their families. Schools with higher vaccination rates and universal mask wearing indoors among their students and staff reduce the risk that COVID will be introduced in the school in the first place and that it would be transmitted in the school environment. This means more time learning in classrooms, fewer challenges with staffing, less disruption and stress to families and school staff, and most importantly, healthier students, staff, and communities. So with that, mask up and get vaccinated. Back to you, Julie.
Thank you, Lacey. It's 10:20. We have got 40 minutes for reporter questions and 7 in the queue right now. So we're going to kick things off with Arielle from the Spokesman Review. Arielle?
Thank you. I have 2 questions this morning. First, what is the department doing to encourage more teenagers and shortly here school-age children to get vaccinated? Those percentages are still pretty low. And they're sort of like the least vaccinated age group in the state. And then my second question is, what is the risk right now going into winter for communities that still have less than 50% of their total population vaccinated? Thank you.
Yeah, great question, Arielle, about all the work we're doing to ensure that parents and guardians have the right information they need about COVID vaccines to feel comfortable making a choice to be vaccinated. So a reminder that the younger ages have been have not been eligible to get vaccine the shortest amount of time, and we see that vaccination rates are the highest for the older ages and continuing to increase for those older ages ages as well. So it really does show that, and they've been eligible to get vaccine the very longest. So it does take time for many people to feel comfortable and feel confident in making a choice to be vaccinated. And it's our job to make sure people have the information they need that's accessible in many different places, including from their healthcare providers, helping their healthcare providers work to reach out to people who haven't been vaccinated yet, have those conversations, do some counseling. We have a code that providers can use to charge for those counseling appointments. So encouraging that behavior in providers is one example. We're also doing a lot of partnerships with community partners on the ground. So trusted community leaders, youth-based organizations, and other groups to help make sure we're co-creating COVID messaging and outreach with them so that information is culturally and linguistically appropriate. And then I think the last piece is really making sure that vaccine is available in multiple locations. So information's available in multiple places and vaccines are available in multiple places so that people can hear consistent, accurate information about COVID vaccines. We understand why parents have questions and concerns about vaccines. And so we want them to get those questions answered and there a lot of them are really common, like talk to me about side effects, talk to me about how the vaccines were developed. So we're gathering that information about the questions people have and then making sure it's available from trusted messengers, including healthcare providers, to help parents have those answers. And yes, Lacey, you want to take the second part of that question about the winter, or Lacey or Scott?
Go ahead, Lacey.
Oh, I can start. Scott, if you want to add anything, feel free. So your risk for COVID increases the more people you gather with, the more close you are in contact with those people, the more mixing there is of groups, and the more time you spend in confined spaces with poor ventilation, especially, so indoors. That means if you're not vaccinated or you live in a community that has a low vaccination rate, going into winter, you're at very high risk for severe disease. So if you have not been vaccinated, now is the best time. Today is the best day to start your series. And then for those children that we think will become eligible soon, getting them vaccinated as quickly as possible so that you can have safer gatherings over these winter holiday months and when the weather is not as cooperative for outdoor gatherings.
Yeah, and Arielle, the only thing I'll add is we've been through this before where we dealt with this outbreak and this pandemic. Granted, it wasn't the Delta variant, which is much more infectious, without a vaccine. And we were able to get through that, myself included. Remember, this team here diagnosed the very first case of COVID in the United States. We have been out to all the prisons, long-term care facilities, where all these outbreaks were long before we were vaccinated, but we were very good about wearing masks, tight fitting masks, pretty universally, and social distancing, so we would be a good 6 feet away. A lot of things were closed, etc. And those are effective. It's like Lacey said earlier, nothing is 100%. Vaccine is probably our strongest and most reliable. So if there's areas of the state where there isn't good vaccination, then you really have to rely heavily on mask wearing and social distancing. Just like Lacey says, no big crowds, no close contact, always wearing a mask. I think where we get into trouble in some of these areas, Arielle, is where the people that aren't vaccinated can also be ones that don't wear masks. And that is where we get into trouble. Turn it back to you, Julie.
Thank you. Our next question comes from Rachel at the AP. Go ahead. Stand by. Rachel, can you hear us?
Yep, sorry about that.
Great.
Good morning. Michelle, how many doses of the 511 vaccine does the state already have on hand ready to administer or has requested? And for Lacey, can you give specific examples of how DOH is working with schools and others to expedite vaccination for the 675,000 kids that will become eligible? Will there be community vaccination sites set up at schools or elsewhere? What sort of information plan is being prepared for students? Any information you could offer on that?
Yeah, thanks for the question, Rachel. We do not have any doses of the pediatric vaccine in the state yet, but we have submitted our first orders for that vaccine. So the state, that is a new vial of vaccine that is being produced. So there will be allocations initially. The state has received about, or has been allocated about 230,000 doses of that vaccine. And we, in this population of 5 to 11-year-olds, there is about 680,000 kids in it. We know they all won't come forward. We do believe from the national polls that about 30% of those parents will come forward. So our doses are kind of tracking to that number. Those doses, we've placed our orders. We opened up ordering for providers, and for the most part, provider ordering pretty much matched what the amount that we had allocated. And so what will happen is the federal government has indicated they will start shipping those to the state after FDA has issued the emergency use authorization. And so they'll be pre-positioned in the state ideally early next week. So once CDC has a final decision, they cannot be used to CDC has also made their recommendations, but they will be here in the state for late next week if everything goes according to plan on the federal timeline.
And, quickly to add, so in addition to the channels that Michelle mentioned and that we've used throughout the pandemic, when a new group becomes available, yes, we are working with schools that are able to either themselves or with a approved provider offer clinics. Many of them have been offering clinics already for their older students this school year or last school year or both. We also have caravan efforts that are focused on this population, youth and families. So, just like every other group that's been eligible, it is our goal to vaccinate these 5 to 11-year-olds as quickly and equitably as possible. That is our path out of this pandemic.
Yeah, the last piece I want to add, I forgot to mention that chain pharmacies who are enrolled with the federal pharmacy program, so enrolled directly with the federal government to receive vaccine, will also receive some pediatric vaccine. And we anticipate that will be around 80,000 doses, we believe. But that vaccine will also be in the state pre-positioned for when we have final decisions from the CDC.
Thank you. Our next question comes from Nicole at Kyber Radio. Go ahead.
Good morning. I have a couple of questions. Senator Patty Murray recently announced $44 million in federal relief for hiring hospital workers. Do you know how many hospital workers that's going to hire and when they might be coming? And just in general, how many federal contracted workers we've had coming into our hospitals to help? And then also with most of society soon now being eligible for a vaccine once the kids are approved, I know there's not a community immunity magic number out there, but is there any sense of when we might get closer to that threshold where we can finally say, okay, enough people are vaccinated? Thanks.
Yeah, I'll have Scott start with the second question, and then I think Andy can answer the question about the funding and federal contractors. Thanks, Nicole.
Yeah, Nicole, so the reason we have this ongoing discussion about community immunity is we have examples of certain infectious diseases that are vaccine preventable. And there's a very clear formula that can help you calculate what % of the population needs to be vaccinated with 100% performing vaccine, which we know no vaccine is 100%. And that is based on its R0 value. So we've been talking, I would have never, 2 years ago, if anyone would have asked me that I'd be talking about R0 to the public and they didn't even know what I was talking about, I'd be shocked. But most of us understand what R0 is, so how many people get infected from a single person. So that formula is really a very simple formula that predicts, given the R0 of COVID vaccine or of COVID virus, what percentage would need to be vaccinated. It's around 80%, depending on what the R0 is. Now, that has changed with the Delta variant, which is much more infectious. So that's a very conservative estimate that 80% of a population would have to be fully vaccinated. And we are not anywhere near that. And the problem is, Nicole, that we've got pockets of like 10% or 20% vaccination. And then we have pockets of 80 to 90% vaccination. So it's not a universal population like a model would predict. So that's the biggest problem we're struggling with in Washington State, is the state is not entirely equal with its vaccine coverage. And so it will actually probably take quite a bit more than that 80% using that formula with 100% vaccine with universal vaccination of 80%. We're going to have to do better than that. And now currently, you know, with kids coming on board with the vaccine, people getting their boosters, people getting natural infection, which will contribute to immunity. Our modelers predict every week what percent of the population is still susceptible. And it's around 30-some%, roughly. So we aren't near that yet. And in some parts of the state may never get that. And that's why we see very different disease rates in the low vaccination areas of the state. So Andy, I turn the other over to you because I know you guys in
I
emergency
also would just
preparedness.
add too, but we also have to remember all health is global as well. And we have the privilege of incredible access to vaccines in this country, which is different than many other places in the world. So there's always a risk of ongoing COVID, especially new variants, just as we support hopefully see increased vaccination rates across the world and increased donations for other countries who don't have the access we do.
All right, Nicole, to your first question. So the $44 million that you're referring to is actually a reimbursement. So the $44 million is an expedited project with FEMA for our GSA contract with ACI that we've talked about for several weeks now. So this was an opportunity for us to get public assistance approval through the FEMA process to get this money quickly to help us absorb the costs associated with these contractual resources. And to the second part of that question, that contract to date, we have 1,096 resources through the ACI contract spoken for, and a majority deployed across the state into different hospitals, healthcare, and hospital systems to support their work, along with our two federal DoD, Department of Defense teams as well that are on the ground in both Providence, Sacred Heart, and Confluence Health. So that is really where we are with our current resource support pool. So 44 million was a reimbursement from FEMA to DOH for the ACI contract. And then we have 1,096 of those folks spoken for and the two DoD teams on the ground.
Thank you. All right, we're going to go now to Keith from Como. Go ahead.
Hi, good morning. I'm checking perhaps with Scott Lindquist on the fact that King County just started its vaccination verification or testing mandate. Is there a consideration in order to get COVID under control to actually have this be a statewide verification requirement or testing requirement?
Yeah, I'm privileged that you put that in my ballpark, but quite honestly, that's not my forte. Les or Lacey, this is really probably best answered by either of you two.
I can take this one. So there is a requirement starting November 15th for verification of vaccine or negative test at large events. So events with 1,000 people or more indoors, or I believe it's 10,000 or more for outdoor events. Beyond that, we are always looking at what our own communities, other states, other large cities are doing to curtail the spread of COVID-19 or prevent transmission of COVID-19, but no decisions made at this time.
Thank you. Our next question comes from Jessamine at Q13. Go ahead.
Good morning, everybody. Thank you for taking the questions and the time. Yesterday at the Snohomish County Health Briefing, we learned that the majority of new cases, about 22% of new cases, were in children 14 years and under I'm wondering if that is a statewide trend that we're seeing in multiple communities, if you have that information. And Andrew, I just wanted to follow up on Nicole's question about the $44 million. I was wondering if you could break it down a little bit further for those of us who don't understand it completely. Where did that money come from originally, and where is it being reimbursed to? And are there any more than the 1,096 that will be hired?
So I can quickly take the second one. Yeah, no worries. So anytime we have a FEMA Stafford Act declared disaster, we are eligible as a state and local governments for reimbursement for eligible expenditures. And that is based on the requirements that FEMA sets forward. In this case, the GSA ACI contract that the State Department of Health is managing, is those expenditures are eligible for reimbursement. And that's what that $44 million is being sent to the State Department of Health from FEMA for. It is an expedited 50% upfront reimbursement to us for the costs we incur for those resources that we are using on this contract. So it didn't really come from anywhere. It's just the federal government reimbursing us for those. Now, the 1,096, the second part of your question there, we had a contract with ACI for 1,210. So we have about 114 resources available still in that contract for hospitals and healthcare systems to ask for. And we are closely monitoring that this week and are ready to work with ACI if need be to expand that contract for more resources if they have them available. Again, a lot of these contractors are working in multiple states providing resource support. So we are doing our due diligence to make sure we have a buffer and are able to meet the needs of our hospital and healthcare systems to the best of our ability. But I want to be very clear about something. This is just one piece of the puzzle. While they continue as hospital and healthcare systems to work in the background to supplement the gaps in their staffing needs by hiring and doing their own resourcing, we are just one mechanism to help support them in this interim period of time. So I hope that helps clarify.
Thank you. Our next question comes from Sally.
I don't think we answered.
Did we not answer? Okay,
no.
Go ahead.
So I think Lacey and I can probably fill you in on this one. The one thing I would say is when we track our outbreaks, since the beginning of this pandemic, bars and restaurants and factories and farms have been a big driver of the leading edge of these outbreaks. That appears to be being surpassed by K through 12 and early childhood outbreaks. Now, having said that, that is leading the edge. We are not seeing an incredibly disproportionate amount of the cases being kids, okay? Just doesn't happen yet. But we are seeing the outbreaks increase. But as my colleagues in local health remind me every day, that's where all the effort's going. They don't have enough staff to be investigating all outbreaks. So schools are doing a lion's share of the work of looking at contact tracing. Schools, we have to understand, we have really put some of this burden of public health on the schools, and they are breaking themselves doing this. And this is giving us numbers that make it appear like this is disproportionate. But I think the truth of this is, while this is a priority, schools in place, transmissions occurring there, it's certainly one of the bigger outbreaks. I'm not convinced that we are seeing a disproportionate amount of these cases in kids. And I do understand how Snohomish is seeing those numbers, but I'm not sure that represents the entire state. Lacey, any other thoughts on that one?
The other thing I would add, so you can, and we can get the link out to everyone here, you can look at case rates by age group. And we have sort of by decades as well as by school grouping age groups. So you can see those trends. And as Scott mentioned, children are not disproportionately represented among cases in Washington state. However, we do want to remind people a very significant portion of children are not yet eligible for vaccines. So, this is COVID-19 is still here, and that means they are at increased risk for getting COVID when at any time they're in a public setting. So really important. I have 2 kids that I think will become eligible for a vaccine soon, and they will be vaccinated as soon as I can get them in, because the rest of society has tried to sort of go back to life as normal. That means more gatherings, more social activities, sleepovers, a whole host of things. And kids who are not vaccinated are not yet protected in the way those of us who are adults are.
Yeah, and I think that reminds me, Lacey, we can say the disproportionate amount of cases is occurring in those who are unvaccinated, period. All age groups. That, we hear about politics, we hear about science, but I think one of the beautiful things about Washington State is we actually have the evidence. We actually gather our experience that hopefully isn't influenced by the politics of the day. And the sheer fact of it is that it's just such a disproportionate amount of, yeah, there we go. Here's the disproportionate amount of hospitalization rates for those that are not fully vaccinated, 16 times higher for this age group. I know it's not the 12 through 16 or 19, but you can see this 16 times higher rate is just our experience with COVID in this state, 18 times higher for this other age group. And fortunately, not quite as high, but certainly a difference for those that are 65 and older. So that's the one thing I would really focus on. If we're looking at the leading edge of this pandemic, it's in those who are unvaccinated. I'm turning back to you.
Would anyone else like to add anything else? All right, don't want to cut you guys off again. Let's go to Sally now with the South Seattle Emerald. Go ahead.
Thank you. Thank you for taking my question. I just want to clarify, based on the slide about J&J vaccine recipients, that those people are eligible regardless of whether they fall into the high risk category by age or occupation.
Yes, that is absolutely correct. So anybody who had got a first dose of vaccine, that was the Johnson & Johnson vaccine. Anybody who is 18 and older and has been at least 2 months since they got that first dose of vaccine for Johnson & Johnson is eligible for a booster dose of vaccine. That is slightly different than the 2 mRNA vaccines. If we put the slide back up, please, of who is eligible for boosters. So if you got Pfizer or the Moderna vaccine, there is a more limited group of people who are eligible to get booster doses at this time. And you can see the list here. And it needs to be at least 6 months since they got their vaccine. And that's people age 65 and older, 18 and older living in long-term care settings, 18 and older with underlying medical conditions, or people who are increased risk of social inequities, or 18 and older who live or work in high-risk settings.
Thank you. Our next question comes from Andrew at The Independent. Andrew, go ahead.
Thanks for taking my question, and I apologize if it's a little rambling. I've been doing some work about the governor's vaccine mandate and those folks who have decided to refuse to get vaccinated. One of the stories I was chasing up took me to Spokane, and I was talking to the sheriff there who's offered jobs to officers who don't have the vaccine. He told me, he's a very smart guy, he told me that he didn't think that getting vaccinated actually stopped the spread of COVID. It merely protected people against dying from the disease or getting ill. And he said, listen, I've got the vaccine, he's the sheriff, but that should be someone's choice. And I said, well, I think that actually vaccines do stop the spread. He'd read a paper from UC Davis, which talked about viral load, but even the authors of that paper say, no, that's not the point that he has taken away from it. So my question, sorry to get there in such a roundabout way, is what message would you folks have for folks like the sheriff of Spokane and elsewhere who don't think the vaccine can stop the spread and transmission of COVID-19?
You want to start, Scott, or you want me to?
No, I was just going to say we all have an opinion and some evidence around this, but why don't you guys go ahead and start, and I'll fill in if we need to.
Yeah, well, I think it is really important that we're not just picking one piece of science and need to be looking at the comprehensive evidence base. But really, one of the pieces, and our data shows this, back to Dr. Lindquist's point, our own Washington data, you are way more likely to get COVID if you are unvaccinated. And most of our cases and hospitalizations and deaths are in people who are unvaccinated. So the likelihood of people getting and transmitting COVID is definitely much greater among those who are unvaccinated. There is some, and we're still learning more about viral loads and a lot of other pieces. There is some evidence that some people who have breakthrough cases could have a viral load that is the same as maybe somebody who hasn't been vaccinated. But a piece of that is starting to emerge, and we have to keep up with the emerging science here, is that the length of time where a breakthrough case may have a higher viral load is much shorter than people who, in people who are vaccinated versus people who are unvaccinated. So there's potential. Somebody who is vaccinated and has a breakthrough case can have a higher viral load and spread it, but it is still proportionately much less likely than somebody who is unvaccinated and gets COVID. Scott, Lacey, anybody else want to add any additional pieces? Yeah, the other piece I want to just say is I think we should recognize how many of our state workers and other people who were part of the governor's mandates made the decision to be vaccinated. It is, I know there are stories out there, but the vast, vast majority of people who fell under the mandates the governor made are vaccinated and working to help us keep our public settings as safe as we can with the tools that we have to prevent the spread of COVID.
I can quickly add, our own data, as Michelle mentioned, show consistently that the majority of cases, hospitalizations, and deaths in Washington state and the US are among people who are not fully vaccinated. We can get you links to those reports. There are also studies that have come out recently that show that the US vaccination efforts have substantially reduced the burden of disease in our country by preventing illness and interrupting chains of transmission. So, while vaccinated people can still become infected and have the potential to spread the virus, that happens at a much, much, much lower rate than people who are unvaccinated. The last thing, you asked what we would say to this law enforcement officer in Spokane. You are a first responder and you are a community leader, and we are extraordinarily grateful for the service you have provided to your community and our state. And we want you to be healthy, and we want you to be able to continue to serve in that role. And part of that role is protecting your community. So, as Michelle said, the majority of people covered by the vaccine requirement have complied and stepped forward and been leaders to protect themselves and their broader community. And we hope that this person and any others would do so as well.
Thank you. Dr. Lindquist, do you have a final thought?
No, well said. I just have nothing to add. You guys are getting good at this. 2 years into it almost.
We do have one follow-up question from Sally before we wrap things up. Sally, go ahead.
Hi, yeah, I just didn't get a chance. I wanted to ask you, you're becoming experts on communication. You think J&J recipients might be confused and think that they need to be 65? And then please tell me the number of J&J recipients estimate for the state. Thank you.
Yeah, the estimate or the number of people who've received doses of the Johnson & Johnson vaccine is 393,000 people in Washington state have received the Johnson & Johnson vaccine. And you're right, it is just like COVID, and just like we were just answering, there is some complicated messaging. It is always not a one size fits all. So that's why we're working to make sure we're communicating this information out there and where there are differences, and helping support healthcare providers and community partners having the right information. If somebody is confused, that's also why we want to make sure that we're encouraging people to talk with their healthcare provider, because they can help sort out eligibility. But the bottom line is that anybody who is 18 and older who's received Johnson & Johnson vaccine, and it's been more than 2 months since their second dose, is eligible for a booster.
Lacey, do you want to wrap things up?
Sure. So thank you all for joining us today. I'm just going to close out, and everybody knows Halloween is this weekend. I want to encourage people to be safe and really have fun. Trick-or-treating is an outdoor activity, so your kids can definitely go out and enjoy themselves, but be safe. If keep it small, keep it to your household or a small group of friends. Wear masks if you are in crowded settings. And for those of you that are older and might be doing other types of gatherings, remember that indoors is more risky than outdoors. Watch your distance, wear masks if you're indoors especially, and remember that a costume mask is not the same as a face covering or a protective mask. So make sure you're wearing that mask as well. And of course, if you have not been, please get vaccinated. But have a great Halloween, everyone. Thanks.
Thank you, Lacey, and to all of our panelists, and to TVW for hosting today's live stream and archives of past briefings. That concludes today's media availability. Have a great day.